It's impossible for me to ignore the events in the Oval Office earlier today. It's stunning. I think anybody watches this saw it, and I'm torn for an explanation. But there's something clear. There's an expression here in South Louisiana. It's not totally true, but it's you mostly hear it from black people, and they'll say that boy ain't right, and if somebody's obviously having some kind of a personality disorder or whatever. Well, when you look at Trump, the first thing that comes to your mind that boy ain't right. And we've seen so much, and we've gotten so hoo-ha, and all of the crazy things that he does. We've kind of become immune to him. Or, I mean, it's almost like a yawn. And this one just stuck out as something really, even by Trumpian standards, it was hard to do something extraordinary. And us being rational people, us being people that believe in reason, are going to tend to wonder, what was the cause of this? What was the cause of this? A man who's obviously for a long time been in decline, who's fat, who doesn't sleep at night, who eats nothing but hamburgers and crap, who's almost 80 years old. There's a tendency to just ascribe it to the normal process of being overweight and having a bad diet and lack of sleep and accumulation of age. But I'm not sure that explains something as dramatic today. And I'm a guy, I like to ask questions. I like to speculate on things. That's why we have this YouTube channel. That's why you viewers and listeners, that's why we get along as well as we do. And I want to see the possibility that maybe I had a point considerably earlier than this when I pointed out on this very channel where Trump had red splotches on his hand, which I was told by any number of medical professionals that when you see that condition, the first thing that you suspect is syphilis. We know from any number of videos that his wife doesn't want to get in the same zip code as him. If you had a spouse that had syphilis, I'm not saying he does. I mean, let me be clear. I'm just asking questions. But what you saw is madness. And I don't mean madness like I'm mad at you, you mad at me, you didn't say this. I'm talking about madness like King George III kind of madness. And it could be a combination of being a fat fucking slob, which of course he is. It could be that he can't sleep at night because his beached whale body can't allow the circulation it needs. I don't know. I'm not a sleep specialist or a medical doctor. But I think we should revisit the possibility of a syphilis diagnosis. And I know a lot of people that watch this channel, or some of you, or we get any number of MDs and professionals that are getting the comments, and some of you just well-informed citizens. But I don't think we can discount the fact that what we saw was mad. I'm not going to concede that I'm just asking questions. I'm just making an observation that everyone saw. We know that boy ain't right. We know that. We saw it. And we know that even in the world of Trumpian standards, the kind of oxymoron to say Trumpian standards, but we know this represents a significant deterioration. And I think we owe it to ourselves to question very deeply as to, and I see this, all these stories. Jake Tapper's got a new book out. about President Biden and who saw the fact that he had lost a step or two in the cognitive area. I don't know. I mean, but that's the kind of question people start to ask. But my question is, who in the White House or around Trump, because they have to know. I mean, we saw it. They have to see that madness, just knowing the way things operate, and you know the way things operate, before something manifests itself in a venue like the Oval Office, in a place with all this. This didn't happen out of the blue. You know, a lot of times you hear, well, they go, Mr. So-and-so, no one knew, there was no sign, he just had a heart attack and dropped dead. Usually that's not true. Usually maybe ignored the signs or something like that, but usually there are indications. I cannot not believe that they were not indications to people around Trump that there had been a significant, and all I know, maybe sudden deterioration. But as we go forward, we're going to keep exploring I don't want to call it a syphilis diagnosis, because I'm certainly not able, I'm not qualified or trained to diagnose anything, much less syphilis. But we got to do a little research here, and we got to see, does this fit an overall explanation? Would this, or the mental issues that come in, I don't know if it's tertiary or secondary syphilis. I'm really not schooled enough, or all I know could be gonorrhea. I mean, but there's some possibility that we have watched the effects of the latent STD, I guess called sexually transmitted disease. But I'll be looking at your comments. And if you think I'm totally off base, you're not going to hurt my feelings, because I'm just doing this kind of without consultation, but I'm just asking questions. And, that's why we have our democracy, or at least until now, we have our First Amendment rights, because we're able to ask questions. And my question is this: could this dramatic event, this deterioration, this unlike any other event in history, could there be a scientific explanation for why it happened? I don't know, but I think it's a discussion that we need to open up and have. Thank you, and hopefully we can come back at some point with something a little more pleasant than, does the president have symptoms of advanced syphilis? I don't know, but I'm asking questions. Thank you.